What should people with gout eat and avoid to effectively reduce pain? Gout is one of the most common forms of arthritis, causing severe pain and significantly affecting the quality of life. However, the disease can be effectively controlled through a reasonable diet and healthy lifestyle. Choosing the right foods not only helps reduce pain, but also helps control uric acid levels in the blood, preventing dangerous complications. Causes of gout. Gout can arise from many factors, including genetics. If someone in your family has gout, your risk of getting the disease will be higher. Diet. Consuming too many purine-rich foods such as red meat, seafood, and alcohol can increase uric acid. Obesity. Excess weight increases uric acid production and reduces the ability to excrete it through the kidneys. Medication. Some diuretics or high blood pressure medications can increase uric acid levels in the blood. Symptoms of gout. Gout often has the following typical symptoms: acute arthritis, swelling, heat, redness, and severe pain in the joints, especially the big toe, ankle, and knee joints. Kidney stones. Urate crystals can accumulate in the kidneys, causing kidney stones and impaired kidney function. Tophi. Uric acid deposits under the skin, forming hard lumps around the joints, ears, elbows, or heels. Nutritional principles to support gout treatment. A scientific diet not only helps reduce gout symptoms, but also controls uric acid levels in the blood. Here are important principles that patients need to follow. Reduce foods rich in purines. Limit red meat, seafood, animal organs, beer, alcohol, and sugary drinks. Increase green vegetables and foods, rich in vitamin C, support uric acid excretion, reduce inflammation. Choose healthy proteins. White meat, chicken, river fish, eggs, and low-fat dairy products are safe choices. Drink enough water. Support the kidneys to filter and excrete uric acid effectively. Limit salt and saturated fat. Avoid processed foods, fried foods with lots of oil. What should people with gout eat? 10 best foods. 1. Fruits rich in antioxidants. Fruits such as strawberries, cherries, apples, oranges, kiwis are rich in vitamin C and antioxidants, which help reduce inflammation and support uric acid excretion. 2. Green vegetables and foods rich in fiber. Vegetables such as broccoli, spinach, celery, potatoes, carrots help balance uric acid and prevent gout recurrence. 3. Whole grains. Oatmeal, brown rice, barley provide fiber to help control weight and support sugar metabolism in the body. 4. Foods rich in vitamin C. Oranges, pineapple, guava, red bell peppers help reduce uric acid, fight inflammation, and boost immunity. 5. White meat, chicken breast, river fish. A low purine protein source helps the body maintain muscle mass without increasing the risk of gout recurrence. 6. Eggs. A safe, low purine protein source, good for people with gout. 7. Olive oil and vegetable oil. Olive oil, sesame oil, peanut oil help reduce inflammation and protect cardiovascular health. 8. Low-fat milk and soybeans. Yogurt, cheese, tofu help control uric acid levels effectively. 9. Coffee and green tea. Coffee and green tea have the effect of reducing uric acid production and preventing acute gout attacks. 10. Drink plenty of water. You should drink 2.5 liters of water per day to help the kidneys excrete uric acid better. What to avoid with gout? 6. Food groups to avoid. 1. Red meat. Beef, pork, goat. Contains a lot of purines, easily increases uric acid in the blood, so limit as much as possible. 2. Seafood. Sea fish, Shellfish, such as shrimp, crab, snails, have high purine content, not good for people with gout. 3. Animal organs. Liver, kidney, heart, stomach contain large amounts of purines, which can easily cause acute gout attacks. 4. Alcohol and sugary drinks. Reduce the ability to excrete uric acid, which can easily cause the disease to recur. 5. Processed meat. Sausages, cold cuts, and canned foods contain a lot of salt and saturated fat, which are not good for people with gout. 6. Some vegetables have high purine content. Asparagus, spinach, mushrooms, lentils, and peas contain a lot of purines, which should be limited when suffering from gout. Controlling gout requires a combination of a scientific diet and a healthy lifestyle. By choosing foods low in purines, drinking enough water, and maintaining a reasonable weight, patients can effectively reduce pain and prevent complications. Hopefully, this article helps you better understand gout and how to build a suitable diet. Apply it now to have a healthy life, no longer tormented by gout.